I hear this all of the time. Patients are taking thyroid medications and they feel no different. Is this you? If you can relate to this, put in the comments, wow, did you just see that spit fly out?
And now, don't change the subject.
If you can relate to this, put down in the comments how long you've been taking the thyroid medication and what kind. And this is the thing you want to consider. If the thyroid medication was going to take your symptoms away, it would have already. Now, there are about 5 to 10% of clients or patients that are taking thyroid medication, and it does take their symptoms away. But majority, 90% of the people that are on the medications, they feel exactly the same. So why is that? The medication itself is not addressing really the root cause of your problem, which ultimately is going to be Hashimoto's thyroiditis. You have an autoimmune condition, not a thyroid problem. I'm going to repeat that. For 90% of you, you have an immune system that's attacking your thyroid, and that is why you have hypothyroid. If you want to get your life back, taking thyroid medication by itself typically is not going to do that for you. It's going to help. It is one part of the solution. You probably need it for now until you can fix the problem, because your thyroid medication is doing nothing for Hashimoto's. It's doing nothing to heal your thyroid gland at all. You will be on it forever if you don't fix the problem. So if you're struggling and you need some help with this, we help people, guide them how to get their life back. It can be done. You can put Hashimoto's into remission. Reach out to us. We'd love to see if you're a candidate.